right, Mr. Young.
Good afternoon. My name is Curtis Young. I'm Director of Social Work representing Parkland Health and Hospital System up in Dallas, Texas. I thank you for the opportunity to be here today, Chairwoman and representatives. I'm here to talk with you about the mental health crisis that's been ongoing for about a year up in our region. And so a lot of what you'll hear from me today will echo what you heard earlier from Sonia Gaines. We do support a lot of what she was saying in her testimony earlier as well. About a year ago, what happened, in case you hadn't heard yet, over the course of the last year, we've actually lost about 500 inpatient psychiatric beds. When you consider the closure of Timberlawn Hospital, Sundance closing 2, as well as Hunt Regional, and then Green Oaks closing their psychiatric emergency room. We almost lost Dallas Behavioral a couple months ago, but they went into an agreement with CMS to keep their doors open. It has created a crisis. Parkland is the county hospital there, so a lot of that overflow has fallen on us. We overnight saw an increase of 40 to 60 psychiatric patients coming through the door, either voluntarily or brought in by EMS or police. And today what I'm here to recommend basically is, one, to thank you for previous year's contributions to mental health funding. Those programs that Ms. Gaines was referring to are absolutely working, and they are absolutely doing some amazing things in our communities, for sure. A couple things that we recommend is in regards to exception item number 27, funding the additional community beds. When we're talking about 75, we'll take it. 200, sure. Whatever you can, we would appreciate it. So, also ensuring that persons with severe mental illness, schizophrenia, major depressive disorder, bipolar, things like that, get access to health care. We're looking at things like the 1115 Medicaid waiver delivery system incentive payments replacement as an option, and that's something that this committee I understand can do. So because district funding will be decreasing starting in 2020, and that is important for us to continue to serve these folks. And then finally, we recommend the fully fund and construction and operation of a North Texas DFW State Hospital. We are the only metropolitan area that does not have a state hospital facility, and getting a patient to Terrell State these days is unheard of from our location. So some of the other things that Parkland has done, just to let you folks know, we were one of the first county hospitals to screen for suicide system-wide of all of our patients that come through our door. We are also expanding our own inpatient unit from 14 beds ultimately up to 28 on July 1st. I would now happily take any questions from the representatives.
Thank you very much for being here and everything that you do at Parkland. Yeah, the 75 beds. You know, when we're making final kind of walk-through budget decisions, we talk about, like, is that scalable? And we usually mean scaling down, but now I'll always think of scaling up. And I'm glad that you bring up the loss of district funds, because that's a very significant issue.
It is.
That we're going to need to address, and I think that's probably the first time we've had that mentioned within this committee. So thank you. I think there's a number of us that are working on legislation regarding that. And then the last thing I would say is that the capital projects in terms of construction of a psychiatric facility, capital projects along with IT are going to be ultimately, we'll make recommendations, but those are ultimately going to be decided by Representative Capriglione's subcommittee on state infrastructure, resiliency, and investment. So I would highly also recommend that you go and lobby GEO for your hospital.
Got it. Thank you.
Oh, yes, Representative Turner.
Thank you, Chair, and just wanted to say thank you, Mr. Young, for being here and for raising these concerns coming up from Dallas. And of course, I hear a lot about this when I talk to people about mental health issues in Dallas, and Parkland is certainly carrying a whole lot of the burden here, and I will be interested to continue this conversation, including about the mental health district replacement issue as well. But just wanted to tell you we appreciate what you do, and thanks for being here to bring it to our attention.
Thank you so much.
All right. Thank